Hello. Hope everyone can hear me okay. Give me a thumbs up if you can hear me. I am sorry here. I'm trying to make sure that I'm on here. Trying out this new StreamYard and all right, I think it's working. Just wait for a few more folks to come in. Let me know that you can hear me okay. I need to turn on my microphone. How's everybody's day going so far? Hope everybody's having a good day. It's 3 hours ago. That's not true. So I wanted to get on today and talk about sorry about that. Wanted to get on today and talk about my upcoming spinal fusion that is scheduled for November the 10th. And as I have stated in or talked about in previous videos, it is my third spinal fusion. The first one was February of 2024, and I had an ACDF, which is I forgot what the A stands for. I just drew a blank. Ancillary. Let's pull out my book here. Interior cervical dissection and fusion. So what that does is they go in your neck and they're able to reach your spinal cord through your neck. Oddly enough, they make a small incision in your neck and go in and take out bone fragment, bone spurs, take out the disc and replace it with bone, or use hardware to fuse the disc together. And that is to relieve pressure off of your spinal cord or nerve roots. In my case, I had both. I had a spinal cord compression at 4, 5, and 6. So they were able to do that surgery, and I got about 6 months relief from that. Then when I went back for my 6 months checkup, which they always do x-rays, they saw that the bone was not adhering to the disc as had hoped. So they decided to do a posterior cervical discectomy and fusion and decompression. And that's where they go through the back of your neck and they make an incision down your spine, starting at the neck. In my case, they shaved the back of my head, probably about right right around the earlobe level, I guess, or maybe a little above, which I wasn't expecting them to do that. And made the incision, went in and put rods and screws in the discs to secure them and to relieve the pressure off of my neck, or my spine and nerves. That was in February of this year, 2025. So since then, I hadn't had much relief. I still have the numbness, the tingling, the neuropathy. My left arm is permanent nerve damage and makes it very difficult to lift anything, hold anything. I'm not able to write or type very well like I used to. Can't grip a mouse to do anything on the computer, so I have to do everything with one finger. And still have a lot of pain in my shoulders and my neck and area. So when I went back for my, I guess it was again 6 months checkup, maybe not even 6 months, I just told them that it just wasn't right. I still had a lot of pain, a lot of um, discomfort. And this was just my neck. I'm not even going to address my lumbar spine yet. So they did x-rays and determined that they wanted to do MRIs and CT and nerve study, and determined that it was adjacent segment disorder, which is the disc above and below. The fusion was now compromised because of the support that it is providing to my spine. So that's the surgery that I'm facing on November 10th, which will be my third surgery in less than 2 years for my neck. With that being said, I wanted to go, I'm sorry, let me back it up. They're going to go from C3 to T1. And he compared it to taking the top off of a convertible. They're going to take the lamina as laminectomy, which is like the pointy bone that you can feel when you like run your fingers down your spine. You can feel the pointy bone. They're going to take that off, and then put rods and screws on either side of that lamina. Since I still do have compression at 4 and 5. So with that being said, I wanted to come on and talk to you about prepping for this surgery. How do you get ready for this kind of surgery? How do you know what to expect? How do you know what the recovery is? And answer any questions that you may have about it. Just one second. Okay. So if you have any questions, feel free to type them in the comment box, and I will answer to the best of my ability. Like I said, this is my own experience, my own opinion. every situation is different. So do your own research and talk with your doctor. I'm not giving any medical advice, excuse me, or anything that is being discussed is um, the end all be all by any means. Every doctor has their own way of doing things. Every physician and every situation is different. So it may not be the same surgery for you or someone else that it is for me. So, as I said, I had to have an MRI and a CT scan so they can confirm which discs are being compromised and where they need to go with the surgery. And this particular one, since it is my third surgery, they're going to go back into the same incision in the back of my neck as they did the second surgery and take the bone out, the lamina out, and replace it with rods and screws on either side. And then they're going to have plastics come in and close up my wound. I didn't have plastics last time. And he said it's because of them going into the same spot that there's going to be, I guess, scar tissue and a lot of muscle that's being cut. So they're going to have to have a specialist come in and close it back up. The last time I had the surgery, when I had the first surgery that went through my neck, it was just a few stitches that dissolved, and there's hardly, unless you know it's there, there's no scar. The back of my neck, the surgery I had this year, there is a very long scar down my neck, and I had 21 staples, which I never had staples before, and it hurt like crazy getting those staples out. So this time I will have staples again. And being that it's 3C3 through T1, I'm not sure how many staples it'll be, but nonetheless, it'll be staples. My surgery is scheduled on a Monday. I'm not sure what time yet. Hopefully it's the first one because I just hate waiting around. But anyway, it's about a 2.5, 3-hour surgery. And then may even be longer than that with plastics coming in. I'm not sure. But then, I'll be in recovery for a few hours and then I will be admitted and I will be in the hospital for 2 nights. So during that time, they'll have physical therapy come in like the next day and work with me, get me up. I will have a neck brace on, and it's a hard plastic neck brace that's like adjustable to each person's neck size. It does have a hole in the front where they're able to see the wound. So in the back, it's so padded up and so bandaged up that they don't have to see it. And you don't take the dressing off until you go back for your first follow-up, which I think is 2 weeks. Does anybody have any questions so far? You can type them in the chat for me if you do. If not, I will keep going. Okay. So they will have physical therapy come in and work with me. They'll get me up in the chair. They'll ask me to do things like twist in the bed, get out of the bed the right way, walk to the bathroom, getting up and down out of the chair, maybe walk a few feet with the walker, which I do have a walker because I was given one last time, and I only use it when I need to walk outside or like in a store or something that I don't have a shopping cart or anything to hold on to. But that I very rarely use it. So before the surgery, let me just back it up there. They like you to, of course, have nothing to eat or drink after midnight. They do want you to hydrate well. So they want you to drink like a protein shake or protein drink, and then Gatorade, like 32 ounces of Gatorade. And I think you can take, they'll tell you which medications you're on and which you need to stop before surgery. But I think you can take the Gatorade with your surgery. I mean, with your medications. Um, I'm trying to get to the page of the day. Yeah, there we go. So before your surgery, you want to make sure that your home is safe for you to return to. So that means like any shower chairs you may need, bedside commode you may need, or a raising toilet seat, grab bars for your bathtub or shower. Make sure that you don't have any like throw rugs around that you could trip over. Rearranging furniture that's easy to get around. If you have a chair, like a recliner, some people find it more comfortable to sleep in a recliner. I got last time, my surgery or earlier this year, I got a reclining lift chair that has like massage and heat and stuff like that. But right now it's more or less just a storage piece in my bedroom, but it does lift up, makes it easier to stand. They'll give you, when you go in for your pre-op, they'll give you the soap that you need to bathe with prior to your surgery, and the instructions on what they want to do. For me, I have to start 4 days before my surgery and use the Hibiclens soap. And then the morning of my surgery, I have to use it one last time. And that's to kill bacteria, things like that. They'll tell you to clean your bedding, sheets, pillows, things like that, so that when you come home from surgery, you have all that already done and clean, because you won't be able to, make a bed or anything like that. And most times, at least in my case, they want you to um, have a plan if you needed to go to a rehab, or if you have someone at home that is going to help you and take care of you. Um, they want to know that that's in place. So that's important to have that plan in place. In my case, my son lives with me, and he's a young adult, and he helps me quite a bit. He's a mama's boy, so he helps me. Um, but to be honest with you, I don't really need much assistance, or at least I haven't in the past too, because I slept a lot. They do give you pain medication to take. I have reactions to some of it, so they have to be careful when they give it to me, but talk to your doctor about pain medications, pain management. Um, I didn't experience much pain after the first one. The most, it was almost instant relief with the neuropathy and the pain with the first surgery. I did have, of course, a sore throat, scratchy throat from where they went through my neck, the front of my neck. Um, But as far as pain in my incision site or anything like that, it itched as it was healing, but I didn't have any pain that I needed to take any pain medication for. With the second surgery, I did have a little bit more pain, and I think it was more the muscles in the back of my neck that were cut and healing. That caused pain. So I did have to ask for more pain medication with that than what they gave me. And I'm not usually one to take pain medication. Usually I can take some Tylenol and I'm good. Anybody have any questions so far about the pre-surgery? All right. Some people have, before they have surgery, they're in physical therapy, and physical therapy will work with you to help get you ready for surgery physically, as far as strengthening muscles that need to be strengthened. In my case, I've done so much physical therapy to the point where there's just nothing more that can be done, physical therapy wise, that I can't do at home. So I don't do physical therapy anymore. Sorry if you hear the flipping of the pages. I'm just reading through my book to make sure I don't miss anything. So like I said, they will tell you before your surgery what medications, you'll have a pre-op appointment, as I did, where they'll like just clear you for surgery, go over all your medications, make sure that you're, that you know which to stop before surgery, what not to stop. They'll do an EKG, they'll do labs, make sure that your iron is good, your vitamin levels are good. My vitamin D was low, so they wanted me to take some vitamin D supplements, which I already do. They want you to stop smoking, vaping, nicotine products prior to the surgery. No drinking, which with the medications that I'm on now, I don't drink anyway, but talk to your doctor about that if that's something that you have an issue with. They don't want you to take any anti-inflammatory or NSAIDs like Motrin, ibuprofen, Aleve, Celebrex, Meloxicam, Voltaren, anything like that. Any herbs, supplements. I think they wanted me to stop my multivitamins. I'll have to go back and check that list. I'm pretty sure that was on there. The only thing that I know they said not to take was, I think that was it, was just the multivitamins. And what you need to take to the hospital is your personal identification. Don't take any large sums of cash, any valuable jewelry. I wear just like a tracksuit, one, two-piece tracksuit that I can just slip on and off, and just some like heavy soled or hard sole house slippers. I don't wear anything that I have to tie or button or zip or anything like that. So keep that in mind. Simplicity is key when it comes to dressing. Your hospital may provide you with toiletries, things like that, but if not, you want to take those. And you will have a catheter. I'm sure most places do a catheter because you are not able to get up. So expect that. Sometimes they'll remove it after the surgery. Sometimes they'll wait until the next day. And, there's different kinds of catheters. So, check with your hospital or doctor about which one they're going to do. Um, so it's important not to have anything to eat or drink. Follow the directions because they will cancel the surgery if you are um, arriving with food on your stomach or a beverage, because it can be a hazard for anesthesia. So you don't want that to happen. So make sure that you follow those directions. If they want you to like have a protein shake or something the night before, if your surgery is later in the afternoon and they want you to drink something, 6 hours before, just follow the directions of your surgeon. Anybody have any questions so far? I am happy to answer any questions anybody has. And again, this is my experience. Yours may be different. Of course, most places, most hospitals put the little cuffs on your legs so that you don't get blood clots while you're laying still. And I think they feel great because they're like little massages on your legs. Some people hate them, but I enjoy them actually. Um, you will probably be on oxygen when you come out of surgery, so don't let that alarm you if you are. They'll assess your pain levels frequently, vital signs, probably do labs like the next morning. Now, if you have the ACDF, which is the one that goes through your neck, and it's one or two levels, they may let you go home that day, later that day or the next morning. The more complicated the surgery, the longer you'll stay in the hospital. Okay. Um, and you do have, as far as physical therapy goes, you do have to meet certain goals before they'll let you go, like maybe walking up a step or two, walking a certain distance with or without the walker, able to lift your legs or knees up, able to get up and down out of bed, able to get up and down out of a chair. So keep in mind those things are those goals that you want to meet before they'll let you leave. And like I said, that's physical therapy, and they'll also do an X-ray before that to make sure that everything is still in place the way it's supposed to be, that nothing moved or came out of place, which I don't think that happens very often, but it's still, I guess, a liability for them to do. And as I mentioned, you will have a neck brace on. Each time that I've had this surgery, I had the hard plastic neck brace that, like I said, is adjusted to your size. And it's got like Velcro padding in it, and you take it on and off. But it is recommended, or how much you have to wear it. When I had the first surgery, I think it was whenever I was out of bed. So, like, I didn't have to sleep in it. Now, when I had the second surgery, which was in February, I had to wear it 24/7. And it was brutal. I think after I went back for my maybe 6-week checkup, they put me in a soft collar, which was much more comfortable. But yeah, I had to wear that. I'm not sure, for another 3 or 4 weeks. It's important to note that even though you're feeling better after the surgery, your body is still healing. It did go through a traumatic event, um, by being cut and opened and hardware put in. So even though you're feeling better, you still need to take time to rest. Don't push it too hard or too far. Keep yourself hydrated. Resume, whatever medications you were on before that, you need for survival. Eat healthy, plenty of water. I'm not going to talk about incision care because that's individual to each person. Like I said, when I had the first surgery, the staple or this sutures just kind of dissolved on their own. And I think I had like some glue or something on there too. And, you just change the bandage as you shower. Each time you shower, you just put a new bandage on it. When I had the second surgery and it was through my neck and I had the 20 some staples, um, that one you kept dry for X amount of days. Then you were able to take the dressing off, like the top dressing off, and they still had the bottom dressing on or something. I'm not really sure how I remember it, but just follow the directions of your physician on how to care for the dressings and the incision. I think I was able to use ice if needed. But again, that's something that your physician and you should talk about. Any questions for me? So, one of the things that I worried about after my surgery was traveling and what I set off the metal detectors in the airports. The answer is no, you will not. Um, you don't have to show them like any kind of card or anything like that saying that you have this in your body because it will not set off any alarms or anything. I have traveled since having the surgery and I have not set off any alarms. The only problem that I had was with the nerve damage in my arm. I was unable to lift my arms up in that little machine thing, but I just let them know and they were fine with that. Um, Driving after the surgery is up to you and your doctor. Of course, never drive if you're on pain medication. And just know that you will not have the same range of motion in your neck as you did before, or you may have a different range of motion depending on how bad the pain was or whatever. But for me, I can't turn my head side to side or can't turn around behind me to look for, backing up or anything like that, or, have to use my mirrors or turn my body to look side to side. So that's something to consider if, you have to go back to work or you have to drive anywhere, when you will be safe to drive. And you don't want to lift anything heavier than 10 pounds, which you're not going to be able to anyway. No bending at the waist. They call it something, and I can't remember what it's called. Um, can't remember what the acronym. No, twisting, turning. I'm sorry, I don't know what it's called. I can't remember what it's called. I'm just looking through this book, and this book is specific to my hospital, so it probably is different than what anyone else would be facing. Um, all right, so that's kind of the basic stuff. So this is the stuff that I found that was helpful for me. You want to stock up on your groceries, stock up on your pantry items. Maybe prepare simple meals that you can just pop into a microwave, or I do a lot of air fryer stuff, so I just depend on my air fryer. I can't lift anything or out of the oven. It hurts to stand at the stove to cook or to stir. So there's no need for it. Just, prepare meals ahead of time, or, if you have somebody prepare meals for you, but you want to make sure that you have a stock refrigerator, stock pantry, so that you can just, grab something. Make sure you have plenty of, water, coffee, whatever it is that you drink. If you are able to get groceries delivered, that's good. I do, however, some things, the way they pack it is too heavy for me to lift, so, consider that as well. So the second time that I had my surgery, when they went to the back of my neck, they did gave me a haircut. I had about shoulder length hair, and I had just gotten it done the week before. Went and had it highlighted and everything, and got a nice cut. And on the second day, I think, the first day after the surgery, the physical therapist got me up, and there was a big wad of hair in the bed, and I'm like, "What is that? Whose hair is that?" Because it was dark. And she's like, "Oh, they cut your hair." I'm like, uh, "Why? That's not my hair. That's too dark. Why did they cut my hair?" And she's like, "Well, they had to shave your hair to do the incision." So sure enough, um, they shaved the back of my head. Um, but it wasn't bad. It was like an undercut because my hair was long. They just lifted up the top layer and just shaved the bottom layer. But why they left it in the bed, I don't know. But anyway, so this time I went to my hairdresser, who's one of my sweet friends, and she gave me a good pixie haircut, shaved the back of it off, so that if they do have to shave it down more, it's not that much. So just consider that if you're having the P posterior, P posterior, if you're having it through the back of your neck. just keep in mind that they will shave your hair. So you want to keep that. You don't want to go and spend money and have your hair done and then them shave it all off unless you want to go and have it done and shave it off yourself. What else can I tell you? You will have medications that they'll send home with you. Like I said, the pain medications, anti-nausea medications, um, constipation medications. I think Senecot and Marilax or something they sent me. Um, extra strength Tylenol. So some physicians will send it to the pharmacy, a couple days ahead of times. Mine sent it to the hospital pharmacy, and my son was able to go and pick it up while I was in the hospital. So it went home with us. So keep that in mind that if you need to pick up any prescriptions or anything prior to the surgery, go ahead and get that taken care of. If you have a grabber, like one of those things that, old people use to reach into cabinets and reach into, I have one. I don't know that I've ever needed it, but I do have it and it is nice to have. You want to have wound care products. You wouldn't use anything like bacitracin or Neosporin or anything like that on that, but like clean bandages. They have a really good kit on Amazon and at Walmart that has different size bandages and gauze and stuff like that that you can use, and paper tape that you can use to change the dressings. So you want to get that taken care of prior to your surgery. Like I said, you don't want to wear any jewelry, any rings, earrings, makeup, um, anything like that on the day of the surgery. Just leave all that home. You don't need that in the hospital, and they're not going to let you wear it into surgery. So take that off. I've talked about the pain after the surgery. And like I said, everybody is different. Everybody has different pain levels, different pain tolerances. So what I experienced may not be what you've experienced. So it's, keep that in mind when you talk to your doctor about pain and what to expect with the pain. Any questions for me so far? Anybody that's watching this on replay, if you have any questions you want to put in the comment section afterwards, I will be happy to get back to you and answer them to the best of my ability. I think that's about all that I can think of right now. I just wanted to do a short little stream, and I know it's almost 45 minutes, but I wanted to test out StreamYard, but I also wanted to just go over what you might expect going into surgery or coming out of surgery. Just kind of give a realistic view from my experience and, again, my opinion. If anybody has any other questions, I'll be happy to answer them. If not, I'm going to go ahead and end this now. I appreciate everybody being here and watching. And like I said, if you have any questions, the replay, please reach out to me. And I hope you like this and subscribe if you haven't already. I appreciate it. I promise it's not always this depressing topic, but it's just something that I wanted to talk about because it does affect a lot of people, and there's not that much information out there from one person's perspective. I will be journeying the experience maybe from the hospital and day after. But yeah, I just wanted to talk about this today, and I probably will be on later this evening with maybe a fun topic that I hope people can join me for. I haven't figured that one out yet. But if there's nothing else, I will sign off for now. And I appreciate everybody being here and listening. And thank you for your likes and shares. Have a good afternoon.